Okay, well, while people are signing on, I'm going to just remind everyone of a few housekeeping related issues before we get started on our 11th webinar in this series. And for today, we are very excited to have colleagues from the L's for Autism Foundation to present to you guys. And they're going to be presenting on supporting positive behavior in the home. So just again, to remind everybody, if you would like to remain completely anonymous in today's webinar, please keep your cameras off during the presentation. You can also change your name that appears in your Zoom login by clicking the 3 little dots on the right-hand corner of your Zoom box and changing your name. The recordings from today's presentation, as well as the slides, will be up on our website. At the end of the presentation, I will post that website for everybody to have. For those that are joining us for the first time today, welcome. My name is Michelle Gorenstein. I am the Director of Outreach for the Seaver Autism Center. For the past 11 weeks now, the Seaver Center has been happy to offer free caregiver webinars, as we recognize that this is a very challenging time for everybody's lives, but especially for those that have individuals on the autism spectrum in their home. So without kind of further ado, let me introduce our wonderful colleagues. Today we have the honor of hearing from Erin Brooker Lozott. She is the Director of Clinical Services and Global Support at the L's for Autism Foundation, where she oversees the development and delivery of all therapeutic and global program initiatives. Erin is a licensed and certified speech-language pathologist. She has been working with individuals with autism spectrum disorder and related disabilities across ages and settings for over 20 years. Prior to joining the L's for Autism Foundation staff, Erin worked for Children's Healthcare of Atlanta Marcus Autism Center as the Community Interventionist Manager, participating in research and educational outreach community-based projects. We also have Christine Honsberger, who is the Early Intervention Services Manager at the L's for Autism Foundation. In this role, Christine helps to develop and oversee behavior analytic services provided to young children at risk for or with a diagnosis of ASD. Christine received her doctoral degree in exceptional student education from Florida Atlantic University and her master's degree in applied behavior analysis from Northeastern University. Christine is a doctoral level board certified behavior analyst and has been practicing as a BCBA since 2005. So we are very happy to have their expertise. And I will say at the Seaver Center, we are also very happy to be partnering with the L's Center for Autism on programming. One last thing that I forgot to mention for today's talk, if you do have any questions or concerns, you can chat directly to me, Michelle Gorenstein, and then I will moderate the Q&A section. So for those that have joined us for the past 10 weeks, we're gonna have a similar format where we'll have Erin and Christine kind of give a short presentation and then leave lots of time for questions and answers. So with that being said, take it away.
Thank you, Michelle. We're super excited to be able to participate in this training, and we're so happy to continue to collaborate with the Seaver Autism Center. We're so grateful to be able to share some information with all of you, and thank you for joining, and hopefully we'll be able to answer some questions and give you some really useful information. So we're very much looking forward to today. Now I'm going to go ahead and share my screen with you all so that we can start talking about supporting positive behavior in the home. So let me see. Okay. We jumped right to the middle of it. Okay, so we're going to start with talking about supporting positive behavior in the home. And before we get talking about behavior, let's just talk about what behavior is in general. And behavior is anything that we do or say, so it includes anything like walking and tucking and sleeping. Some behaviors we're born with, like sucking and crying, and other behaviors we learn. We learn these behaviors through our interactions with our environment, how our behavior influences what other people do and how they interact with us. And we don't always just address all behaviors in terms of providing intervention and thinking about treatment. We always want to look at what is a behavior that's causing some interference with learning or socialization. And, you know, thinking about behavior, we don't just behave appropriately because that's what we've been told to do. We're not engaging in good or bad behavior. We engage in behavior that works for us. And so when we think about our kids, we always think about how their behavior is serving a function for them and how it's helping them get their needs and wants met. And all behavior, it serves a communicative function. Whether it's positive behavior or behavior that we want to address, it's communicating with us something. And it's our job as parents and as educators and therapists to try to figure out what is that behavior communicating. So almost all problem behavior with children, with adults, is an effort to communicate with us. And so we become detectives to try to figure out what is that problem behavior communicating. And that's why we have to understand the function of behavior. So I'm sure many of you are familiar with, you know, having these discussions about function and what is the function of behavior. And that's what we're going to talk a little bit about, is why that's important, what those functions could possibly be, and then some strategies to help support the behaviors that are happening for a particular reason. So in general, challenging behavior, all behavior is a form of communication. It's communicating something to us as parents or teachers, that all of that behavior has a function. Behaviors continue when they're reinforced. And so we know that if it continues to happen, there's reinforcement happening, whether it's in the environment, whether we know it or we don't know it. We change that behavior when we want to address it by altering what happens either right before the behavior happens, or by our consequences, what the consequences are after the behavior. And then always in terms of when we're thinking about, oh, here's this behavior that we want to address, we always want to think about what a replacement behavior is to that challenging behavior, because we can never just decrease the behavior. That doesn't work. So if we think about, here's the behavior and we want to target it and we want it to decrease, but we haven't already planned for what that next behavior is going to be, we're going to force our children to choose that for us. So we always want to think about, what do we want to increase? What are we trying to teach? And it's not all just about decreasing behavior. So some of you may be very well versed in the 4 functions of behavior. Some of you might just need a little reminder. I think it's a reminder that we all need sometimes, is that sometimes we're looking through a particular lens, and when we see a behavior happening, something that we want to target, we always want to think about what those 4 major functions of behavior are. And so let's go through each one of them a little bit. And I know that I'm going kind of quickly through this material, but I want to make sure that we're able to touch on all of these things so that I have a lot of time to answer those questions for you afterwards. So the first one is attention. So we engage in certain behaviors to get the attention of other people. And it's not always positive attention. I think that's one of the things that people can get caught up on, is that it's not always, kids and adults and adolescents aren't always doing things to get positive behavior. Sometimes it's negative attention that can function as reinforcement for a particular behavior, such as a reprimand. That, you know, it doesn't, when we think about what a reinforcer is, we don't always think about reprimands, but a reprimand could reinforce attention maintained behavior. Eye contact. Sometimes it's as simple as looking at a child when they're engaging in inappropriate behavior that might strengthen it in the future. Touches, saying no, all of these things can function as attention and potentially increase the likelihood that that behavior will continue. The second is escape. So sometimes we all engage in behaviors because we're trying to avoid or escape doing something we don't want to do. Anytime that demand is removed, it can be escape. And sometimes as parents, we do these things accidentally. We say, it's time to clean up your toys, and then the phone rings and we have to go take a phone call and the child gets to continue playing with their toys for a bit longer. Sometimes it's intentional. You know, we say it's time to clean up your toys, and our child starts crying, and we say, okay, you can have another minute. That is an opportunity where we might have strengthened that crying, and it's a great thing to think about. Well, what could they have done in this moment that I could have taught, that instead of crying, they could have said one more minute, or used a picture to say one more minute, or a device to say one more minute. So thinking about escape and avoidance, we engage in behaviors to try to avoid doing something we may not want to do. The third is getting access to things. So sometimes we all engage in behaviors to get access to things or items that we want to have access to. And sometimes it's to get something back, and sometimes it's to get access to something like the iPad or the playground, or getting to jump on mommy and daddy's bed. And finally, the fourth one is automatic. So these are behaviors that occur regardless of the social situation. These behaviors we all engage in. It's twirling your hair or tapping your pen. It's something that it feels good. It provides some level of sensation that we all enjoy. And sometimes we don't even know that we're doing it. It just kind of becomes a habit. And so sometimes for children and adolescents and adults with autism, it happens at a higher level. Hand flapping or rocking, and it might interfere with learning or interfere with socialization, and that might be one of the reasons that we would target that for intervention. And sometimes a behavior can happen to stop pain or for some aversive stimulation. So sometimes if we see a child engaging in challenging behavior and it's a brand new behavior, we want to think about, could this be happening because they have a headache, or did they just start biting because they have a toothache? So we have to play detective and really make sure that we're looking into all four of these functions in order to develop a really effective treatment and have a really good way to support that positive behavior at home. So again, why is this important? Well, we can't just come up with an intervention or come up with a treatment without knowing this function and hope. We don't want to just do that and hope that it works. We want to make sure that we have some information, so we're really sure that the thing that we're targeting and the way that we're going to teach some new skill or new behavior is really likely to be effective and efficient for the child. So the way that we do that is by collecting ABC data. So I'm going to talk to you a little bit about this. I'm sure I would ask you all to raise your hands if you've had experience collecting ABC data. Erin's had some experience collecting ABC data. If it's something that is a way that we look at trying to identify those functions. Sometimes it's parent interviews and questions, and sometimes it's interviewing each other and saying, something happens with mom and it's very different with dad, or very different with grandma and grandpa. And especially now that we're spending so much time at home, if you've opened your social distancing bubble a little bit and maybe have some other family members that are helping out at home, sometimes we see behaviors that happen with certain family members and not other family members. And so these are really helpful questions to try to figure out, well, why when grandma does this, does the child respond in this way? But when I do this, that's not the case. We have to try to figure out, how is grandma presenting it in a different way, or maybe she's responding in a different way that's reinforcing that behavior. So when we talk about the ABCs, we're talking about the A is the antecedent. So that's what's happening right before the behavior happens. So an example might be that you say, okay, it's time to eat dinner. And then your child starts crying and you say, oh, I see that you were in the middle of playing with your Legos. It's okay, we can have dinner in a minute. And when you jot that down, you have your antecedent. So you said, it's time to eat dinner. The behavior of the child was that they started crying, and the consequence was that you provided an additional amount of time playing with the toys. And the challenge with collecting ABC data and the beauty of it, and what we want to really make sure we do consistently, is that we write what really happened so that we can get a sense of what those consequences are. Because I know for myself, and maybe parents and other therapists out there have had this experience where you give an instruction, or you ask the child to do something, ask your client or to do something, and a behavior happens, and then you respond a certain way, but it may not have been the way that you really wish you had responded in that moment, that you had thought through, okay, I'm not going to say no, I'm not going to reprimand, or I'm not going to provide a lot of attention, but you did. So it's important to make sure that you write the consequence of what actually happened so that you can get a sense of, is this behavior being maintained by attention or continued access to things or escape from a non-preferred activity. So we kind of went through this, the antecedent. One of the things when we think about supporting positive behavior is that we really want to be objective in talking about behavior. We want to make sure that we're looking at what actually happened in the environment versus inferring states. So it's important to jot down observable occurrences. So instead of saying, my child was tired, we might say they put their head down and closed their eyes, because that's something that we can see, and what it looks like for me to be tired might be different for somebody else. We're going to write down the child's behavior again in observable and measurable terms. And then, like I said, we're going to talk about the consequences, what happened. And it might be more than one thing. It doesn't have to necessarily be one thing. It might be that you said, okay, you can have one more minute. And you also, the phone rang, so you also turned on the TV at the same time. So sometimes there's multiple things that happen as a consequence to behavior. And we know, as we talked about in the very beginning, that behavior is strengthened or weakened by its consequences. So, sometimes what we do after a behavior reinforces the likelihood that that behavior is going to continue. Sometimes it punishes it and it's less likely to happen. And sometimes it doesn't really have an effect. So we just want to be aware that our consequences are impacting the child's future behavior. So now what do we do? Now we know that this behavior is happening because the child is trying to get attention. So the next step in that is thinking about, well, what could we teach this person to do differently? What could be a more appropriate replacement behavior to this inappropriate behavior? So again, thinking about supporting positive behavior, we're always thinking about what can we be teaching? What can we be reinforcing that would be positive and help this person get their needs met? There's certain criteria that we want to make sure we think about when we're talking about replacement behaviors. We want to make sure that they're socially appropriate, that they meet the same needs, which is again why we do that functional analysis. If I said, it's time to come eat your dinner, and you started throwing your toys, and I taught you to say, can I have one more minute? But it wasn't because they wanted to continue, the child wanted to continue playing with their toys, it was because they didn't want what was for dinner, then it wouldn't necessarily work. That intervention wouldn't be really effective because I wasn't helping my child communicate what they were really trying to communicate to me. It has to be as easy as the challenging behavior and efficient. So those, again, are kind of really important pieces to identifying a replacement behavior. You want to make sure that what you're asking your child to do, what you're asking your client to do, is not more difficult than what they were already doing. Otherwise, it won't necessarily work. And then when we think about efficient, it has to work really reliably, especially initially. It should almost work almost every single time if possible, so that your child understands, oh, okay, well, instead of doing this, I can do this, and it's going to work just as well and be just as easy for me. So one of the keys of supporting positive behavior is reinforcement. We all do things to access reinforcement. It's what makes the world go round, whether it's social reinforcement. When I cook dinner, we have a thing in our family where you have to say like, and everybody has to if they like their dinner, and that provides it wouldn't provide reinforcement to everybody, but for me, that's when my kids are and if nobody says anything, it's like this awkward time at the dinner table that nobody gave me the for dinner. So everybody's reinforcers are different. That wouldn't work for everybody, but it's something that, reinforces me for doing it. So in that example, if I made something that everybody really hated and everybody gave me a that would make me more likely to make that same dinner again. So if they don't like it, it really behooves them not to give me an because it's going to strengthen my behavior, and I'm going to serve them the same ratatouille that they really didn't like, but unfortunately reinforced my cooking behavior. So when we think about reinforcement, it's anything that we add after a behavior that increases the future likelihood of the behavior. And I know that seems like we're trying to be technical in terms of reinforcement. But I hear that a lot. And when we talk to teachers and parents, sometimes people will say, I tried reinforcement and it just didn't work for my child. Well, we tried giving something to a particular person that maybe they liked, but it didn't function as a reinforcer. And so reinforcement as a principle and as a strategy works, but not everything we try functions as a reinforcer. And I often give the example that I like cheesecake, but if you paid me in cheesecake, it wouldn't necessarily be an effective reinforcer because I also have to pay a mortgage and a car payment. So I need something more than cheesecake as a reinforcer. So I might like it, but it isn't going to be the reinforcer that continues my behavior. So again, if you know, how do we know something worked as a reinforcer is only by the future likelihood of that behavior. So in thinking about supporting positive behavior in the home, if a child is engaging in a particular behavior to get attention, we want to think about providing lots of attention for more appropriate behaviors. And think about teaching behaviors that could function as ways to get attention. So if I was talking to a mom recently who was having an experience where when her child couldn't get the internet to work, he would start whining with the iPad. And we talked about having him say mom or hand over a card for mom to get her attention so that then she can come over and help fix the iPad. And just by doing that, it gave him a functional way to communicate that he was having difficulty without, and she had an opportunity now to reinforce a really positive behavior versus addressing the challenging behavior. Sometimes when we're home and we're busy doing lots of things, attention maintained behaviors, we can see that a lot. So you're cooking dinner and your kids were playing so nicely, but then all of a sudden it's complete pandemonium in the playroom. And when sometimes as parents, we watch our kids and they're being so good and we kind of like tiptoe gently out of the room because we're like, oh, they're doing so good. I don't want to say anything. I don't want to disrupt this perfect moment. But in reality, that's probably a really great time to provide some positive reinforcement and some attention, saying like, I love how you're playing all by yourself. And sometimes this takes us being really proactive and setting a timer while you're cooking potentially, that every 5 minutes, you're going to remind yourself to peek your head into the playroom and say, I love how you're playing so nicely. You're doing such a great job in the playroom. I'm so proud of you. And then going back in and finishing cooking dinner. So just one small strategy that can really help kind of reinforce positive behaviors instead of focusing on what do I do when things just deteriorate into pandemonium in the playroom. That isn't necessarily where initially it's really positive to focus on these other antecedent kind of manipulations. So again, thinking about, for behaviors that occur when there's not a lot of attention, think about, low attention times of the day. At home, we all have these, whether it's because you have to help another child do some homework, it's because you have to get on the phone, do a Zoom call, or get on the phone for work. And in these times, we want to think about proactively how we can arrange the environment so that the child doesn't have the need to engage in some of these less appropriate behaviors. So sometimes it's a matter of restricting toys or special video to just this time of day. So instead of having free access to the iPad, you schedule in times of the day where the iPad is available, and that happens to be at times when you have to hop on a Zoom call or while you're cooking dinner. And then also thinking about teaching specific behaviors such as waiting, which is a tough one for all of us. I don't like to wait for things, but it's something that's really important. So if your child has a difficult time waiting, it might be a nice time to start teaching that behavior now that we're home and we have lots of opportunities. And this is such a big one for all of us. Planned ignoring, I'm not going to talk about too much, but if you're providing lots of attention for a behavior, this is something definitely to talk about with a clinician. If this is something that a behavior is happening, there's a strategy called planned ignoring where you remove some of that attention. The challenge and something to just be aware of is that when a child is engaging in a behavior to get your attention, when you stop providing that attention, chances are that behavior is going to get worse before it gets better. So it's something you want to make sure that you're being really planful for and not using if there's a particularly dangerous or self-destructive or self-injurious behavior. We think, that the likelihood is that when you remove that attention, the behavior is going to get worse. So it's definitely something to talk about with a therapist or provider, an educator. Okay, moving into escape maintain behaviors, when behaviors happen because you don't want to do something or something's really hard. Think about, again, using reinforcers. So I don't want to clean up my room, but I know that if I clean up my room, I'm going to get 5 minutes of a story time with mom or dad. Using a first then schedule, so that really helps to give some visual predictability. I don't really want to do this, but I know once I do this, I get to do this fun thing. So I don't really want to brush my teeth, but I brush my teeth and then I get to read a book in bed with mom and dad. Or I eat my chicken first and then I get my French fries. Again, thinking about a functional communication alternative. So if I don't want to do something, if the only way that I know how to tell you that I don't want to do something is by pushing it away or crying, then I need to know how to tell you that I don't want to do something. And that might be something as simple as, saying no, or hitting a button that says no, or exchanging a card. We want to make sure that we're identifying that this is a communication, a way that our children are communicating with us, and how to give them some supports and teach some new skill to help them communicate that same message. When we think about escape maintained behaviors, we also want to make sure that we're giving an effective instruction, so we're not reinforcing that escape. We want to make sure that we're not asking kids to do things that are really hard, that instead of saying, clean up this entire room that has Legos all over the place, we might clean up 75% of the Legos and then say, okay, let's put these last pieces of Legos together, put these last pieces of Legos away together. And then you have an opportunity to now reinforce compliance and cleaning up, as opposed to giving this really large demand that was really difficult, and then dealing with some inappropriate behaviors. Again, it kind of goes back to that concept of reinforcement, and wanting to make sure that we're giving reasonable expectations. Thinking about supporting positive behavior, if the function of behavior is access to items. If something isn't available, try to offer 2 alternatives. I think this is such a big one that sometimes it's raining out, or in the era that we're in now, lots of things aren't available. Going to a playground, for us at least here in Florida, is still not available. Going to a movie theater is not available. And so thinking about, if you know that something isn't available, what are 2 other potential options that the child might enjoy, or that might substitute? It may not be perfect, but I know you want to go swimming, but it's raining right now, so we could read a book inside, or we can do a silly exercise video. Giving warnings is another big one before terminating an activity. Sometimes we know in our head when it's time to do something different, and we don't necessarily always communicate that as well as we should. And if we think about if I was watching TV and my husband came in and just changed the channel on me, I would be really upset with him. But if he told me, hey, there's a show I really want to watch in 5 minutes, can I come in and can we watch that in this TV? I would be much more likely to be okay with that, unless it's baseball, because I don't want to watch that. But sometimes it's good to use a timer to make sure that having that signal is really helpful. Again, going back to this communication, making sure how the child knows how they can get access to that item. So it might be, I know that the playground's all done for now, but let's go put it on your schedule and we'll come back tomorrow. So that we're making sure that we're communicating with our kids, and when things are available. Giving choice is another huge one that can really help to support positive behaviors. Sometimes so many things are put on us without having a choice, that just that option of having some choice. Even we were talking about it recently, that forced choice of, Erin and I are big fans of, with our own children, like, I know, you may not want to do this, but you can use you may not want to brush your teeth, but you can use the pink toothbrush, or you can use the blue toothbrush, or you can use the minty toothpaste, or you can use the bubblegum toothpaste. And sometimes just having that choice is really helpful. Do you want to jump in on any of that, Erin?
I was thinking the same exact thing when you were saying forced choice, because we always assume that choice has to be choice between two good things. And it doesn't necessarily have to be two good things. It could be just two choices, and the child still feels that they have some control over making a decision, but we're really controlling the choice set in which they choose from. And that in itself, you know, is proactive and preventative of behaviors coming and allows for communication. So I was like, you took the words out of my brain, Christy. That's great.
Well, and you know, and thinking about choice too, going back to escape maintain behaviors, if I really don't like doing my homeschooling activities, and I don't like doing my math activity, and I don't like doing my reading activity, and I don't like doing my PE activity, sometimes being able to choose which ones I want to do first, second, or third can really support positive behavior. Because when you don't like doing any of those things, but at least you have a choice of what you want to do first, second, or third, sometimes just that alone can make a really big difference in supporting positive behavior. Okay, so I jumped ahead a little bit for escape maintain behavior. So if we don't want to do something, or we want to avoid doing something, sometimes it's a matter of just changing the environment. So instead of saying, here, we've got this whole boatload of work to do, we might present one thing at a time so that the child doesn't feel super overwhelmed with the amount of work we have to do. Think about if you're at work and your boss comes and dumps like a whole big load of projects on your desk, it might lead to some challenging behavior or some avoidance behavior where you're going to start doing things that are less important, or checking your email, or making some phone calls. But if you have one task to do, it feels much more manageable. Sometimes it's a matter of just changing the environment too. If the environment is really distracting, it might help to kind of limit the toys that are in front of, you know, the toys that are around, or the sound. Maybe it's using if you're in an area where there's lots of traffic noises and you want to look out the window all the time, maybe having like a white noise machine might just kind of help focus attention on the task at hand. And then thinking about if the function is access to items, and thinking about consequences. What we want to make sure that we're doing in terms of supporting positive behavior is not giving in necessarily, is being able to be really consistent and say, I know, I hear you, I know that you really want to swim in the pool, but that's not available right now. Come on, let's go do a puzzle. And then not spending a whole lot of time in that kind of back and forth negotiation, being really consistent, that, you know, and then trying. Sometimes a really good strategy in supporting that positive behavior is playing with the toy. And when the child, or, you know, doing the activity, all of a sudden that looks like a really fun thing to do. And there's that distraction from the original desire to a new activity. Being proactive in terms of automatic reinforcement, if we're doing something to get that kind of sensory feedback. Sometimes just enriching the environment, having activities that focus on some visual or auditory or kinesthetic or olfactory input can be really helpful. And oftentimes some of those self-stimulatory or repetitive behaviors happen when we don't necessarily have play and leisure repertoires. And so really focusing on, well, what could we be doing instead of this? Maybe we can teach some new play skills is a nice way to think about being proactive and addressing that function of behavior. And that is all the information that we wanted to make sure we kind of covered, so that we can have a chance to really talk a little bit more about how these things might impact your lives now, and some situations that you're working on, just kind of getting your thoughts focused on kind of these 4 functions of behavior, and then how we might be able to use some positive behavior supports to make sure that that you're able to address those functions. Erin, did you have anything else?
Yeah, I just wanted to make a point that there was someone that wrote in the chat box that she always gives, when we were talking about choices, that she always gives 2 choices, and when she wants she always gives choices of what she wants her child to do, and the result is that they like to choose, so the work gets done. And then she also mentioned having a positive, using a first then board having a positive impact. And I think both are really great from a standpoint of prevention of challenging behaviors. We're giving someone to feel like we're not imposing choices on them. And then we're also allowing for predictability of what's coming first, what's coming next. And especially if that first activity is non-preferred, that a preferred activity may be coming, again, supporting a child and being able to stay with and tolerate a more difficult task. So just to make sure we responded to the comment that they're excellent strategies, and the results are obviously going to be positive because they're evidence-based practices.
And you think about like how often we, how it just doesn't feel as positive when we're told to do something versus asked to do something. It has a very different feel. And even, as adults, when we're told to do something, sometimes you can have a negative reaction to that versus if somebody gives you an option or gives you some choice, it makes you feel like you're more a participant in that situation versus somebody who's just being kind of directed, and that feels much better.
And thinking about that, Christine, thinking about individuals with autism and having communication delays, if you give someone a choice, you're giving them the words that they can use to communicate for what they need versus having to then retrieve this information on their own when they may not, even though they understand possibly the concept, have the ability to pull that word out in that moment, especially if they're feeling stressed.
Absolutely.
So I think that we're at a place now where if anybody has any questions, Michelle, I think you have to post any questions or comments in the chat.
If you have any questions or comments, please post in the chat. If you wish to remain anonymous, you can direct a question directly to me, Christine, or Erin, and we will share it and do our best to answer. So someone just wrote, what can speech pathologist and BCBA give diagnoses of?
So from, do you want to take that first, Christine? You want me to respond first? You respond after. I'm going to respond from an SLP standpoint, a speech language pathologist. Although I'm trying to get through my BCBA coursework. So a speech language pathologist can diagnose a child with social communication disorder, language disorder, if there's a developmental apraxia of speech, anything related to speech, language, or communication. There is, from the standpoint of a diagnosis of autism, there are very clear guidelines on professionals that should be diagnosing autism, meaning a medical doctor that's a developmental pediatrician, a neurologist, a psychiatrist, a licensed clinical psychologist, or a geneticist. There has been some talk that the American Speech and Hearing Association feels that speech language pathologists with specific skill sets could be able to diagnose autism, but it's not yet a practice that's utilized, and I don't recommend it at this time until there is truly a subspecialty and a true mission statement for that. So right now, as a speech language pathologist, we stick to providing more communication and language-based and speech-based diagnoses, not medical diagnoses or anything that would specifically, other than a social communication disorder, come out of the DSM-5 per se.
From the perspective of a BCBA, that's diagnosing autism is outside the scope of a BCBA. There's often psychologists that also have a BCBA credential and have had advanced training in diagnostic evaluations and assessments. And so that, they have an added layer, of a BCBA potentially onto their original degree. In our clinic here, we have a very transdisciplinary model, and so sometimes it's nice to have some feedback from additional professionals in that discussion of a diagnosis, but it is not in the realm of a BCBA to provide a diagnosis.
And I think this sometimes gets a little bit confusing when you do have either a transdisciplinary, multidisciplinary diagnostic team, and there's a speech pathologist or a behavior analyst or somebody that's not part of these specific medical professionals or licensed clinical professionals to make the diagnosis, because we add information to allow for the diagnosis to be very comprehensive and complete, but it's not necessarily us making that final decision or putting the stamp onto that diagnosis.
So I have a question here about advising somebody for kids who are wanting to pack and leave an area. And so my thoughts in regards to that particular question is thinking about, going back and being kind of a detective and thinking about the functions of the behavior. So is it a particular area that the child is potentially trying to leave? Is it a work situation that the child is trying to leave the work situation? Is it because they want to go somewhere else? And so I think this is such a perfect question to sort of illustrate how many different, that you can have one behavior and it could be happening for a bunch of different reasons depending on the child. And so you might have one child in a classroom or in a bedroom or in a clinic room that wants to leave. And maybe for one particular child, they want to leave because they want to go somewhere because there's a playground nearby, or they want to go out to the pool in the backyard, or they want to go somewhere. For another child, it might be they're trying to leave because they don't like what's being presented to them in that environment. And so they're trying to avoid the tasks being presented. For another child, it might be because they just want to, they want to see somebody that's outside. They want to get some attention from a different person. So it's really important to think about the functions of behavior. I think as a whole, it's important to think about reinforcement. And if the reinforcement for those particular tasks in an environment are not there, then we might see more of these kind of escape behaviors. But again, the particular behavior isn't necessarily what's going to help guide your intervention. It's figuring out why that's happening. So if a child is leaving to go to the playground, we're going to try to teach that child to ask to go to the playground. If it's because the tasks are really hard, we might think about altering how many we present, or altering the reinforcement that we're providing for each task. So it really depends on the function of that behavior.
And I think, Christine, what you spoke about when I raised my hand earlier about the antecedent behavior consequence, or ABC data, it's really such an effective data collection system to be able to identify and understand, or even hypothesize what the function is, because you're looking at what happens right before the behavior, then what happens with the behavior, and what happens right after, so you don't have to guess. And that, for me, as a speech language pathologist, has made a huge difference in my ability to be productive in my work with individuals with autism, as well as in my life, even with my own child.
Mm-hmm. Absolutely.
I have a question for you guys. So we have caregivers on the call whose children were getting services through a BCBA in school, but we're never getting those type of services in the home. And parents are now seeing more maladaptive or attention-seeking behaviors in the home. Obviously, your center has fabulous resources online. Are there other resources that you can provide families or websites to go to if they don't have access to a BCBA and kind of are interested in either trying out some of these strategies or figuring out what strategies might work for their child?
Absolutely. So I can make sure it's added to our slides, but we do, on our website, we do have a page dedicated to resources specifically for COVID-19, and we have links to different organizations that have provided resources similar to, I know you guys do as well with the Seaver Autism Center, but we do have that. So I can make sure that that's included on my slides, so that everyone has that link.
And then we also have a variety of virtual services and virtual telehealth-based services. So because we are in Florida as our main site, but we are a foundation that supports and serves individuals across the world. We're a global organization. And so you don't have to live in Florida or be someone that would be local to our campus to be able to access even our on-campus or our telehealth services. And we are offering behavioral consultations through telehealth, as well as many other therapeutic services. So if anybody's interested, those services are also on that same website, and the same link that we can include when we send our slides. we would love to be able to have families from New York and surrounding areas access our services. I think that we're doing a great job with our telehealth. We've become very innovative through COVID-19.
Great.
And we do have free webinars on the website as well. So if providers or families are interested in learning about more specific topic, we have a lot of free webinars that are already there, such as toilet training or evidence-based practices, things, a variety of webinars. So if anybody would like to browse the library, that's also on our website.
For sure. Michelle, I just saw the question about someone who asked if there's a speech therapist can diagnose selective mutism. And so I've actually evaluated a couple kids during my career that didn't seem to meet criteria for why they weren't speaking for any speech and language specific reason or developmental reason that I could evaluate that appeared to meet criteria for selective mutism. My practice would be to say that to say in my report that the presentation of the child is indicative, right, of selective mutism, and I would refer to a licensed clinical psychologist for that full diagnosis. I don't believe it's in my scope of practice to make that defining decision. However, if there was absolutely no access, and limited access, it's something that I could definitely support from my training from an intervention standpoint, but still wouldn't feel comfortable unless a psychologist collaborated with me, just because it's not my area of expertise or part of my diagnostic training to evaluate that.
And typically I would say that's what I wasn't sure, because I know typically it's done by a licensed clinical psychologist or even a child's adolescent psychiatrist. But
yeah, so psychiatrist or a licensed clinical psychologist that really has experience in the field would probably be maybe a psychologist to get a full profile, and then if a psychiatrist was part of the plan. But yeah, I would definitely probably use that as this is what I'm thinking, but here's my referral.
Great.
I do have another question.
Perfect.
In terms of pointers to kind of keep consistency from home and school. And I know there was another webinar that was posted on the Seaver Autism Center website. I don't remember exactly which one it was. Michelle, maybe you can help, about environmental arrangements and using visuals.
Yes. So one of the first webinars that we did was on structuring the environment.
Okay, because I think that one, if you haven't seen that one, I think it has so many great elements to think about how to make home therapy or homeschooling kind of similar to school, or things that you need to think about, because I think one of the biggest things that we don't think about is the environment and how important that is. That, when you're used to using your bedroom to play and relax, and now you have to sit there and do a lot of learning tasks, how we can kind of create the environment to make it really supportive of learning. Also really that consistency. So if you have children that have behavior plans and IEPs at school, making sure to kind of review them and see what strategies maybe are being used at school so that you can implement them at home. If there are reinforcement systems that were being used in therapy, to be able to use some of those at home can be really helpful, even if there's a telehealth visit with one of your providers, just to get a sense of how to then generalize those strategies into home. I think in general, that concept of reinforcement and targeting positive behavior can be so helpful. Instead of thinking about how do I decrease this behavior, it's changing that mindset of how do I increase this different behavior to get the same needs met. And then using those visuals, creating that predictability are all really, that's what we have in school and work, is that we have that predictability. I know what I need to do next. But now that everything has kind of been tossed up in the air, it's hard to create that predictability sometimes. So the more that we can do that, the more supportive it can be of positive behavior. Let me see if I have any other questions. And I got an additional comment about sort of, making sure to identify the appropriate behavior. And I love that's a strategy that you use. because I think that it's such an important piece that when we focus on the positive, you're surprised at how you can kind of strengthen that behavior through just your attention and providing some reinforcement. And many people have asked about recording, and Michelle, you said that it'll be recorded and the slides will be available.
So I just posted the Seaver Center's website. Slides should be up, I would say, by the end of next week. Recordings to be determined, but all the slides will be up, as well as our previous webinars. So we have a few more minutes. If anyone has any other questions to ask, please enter in the chat. Also, we've been picking our topics based on your feedback. There are lots of great resources out there right now for families, and we don't want to kind of be redundant. We want to create resources that families feel like they need. So if there are specific topics that you feel like you're struggling with, or that you have not been able to get resources for, please also chat me directly those ideas, and we are happy to either pull something together within our own staff or reach out to other experts to present with us. So here is the website for Seaver Autism Center's COVID-19 resources. I will also say, based on feedback, the Seaver Center is going to be offering some virtual supports over the summer in the form of social skills groups and parent support groups. If you want more information, you can always email me, and I'm happy to talk more about what those would look like. We do have another question, probably to Christine and Erin. What if the child wants cash as a reinforcer? What is the difference between reinforcement and bribery? Tickets, tokens do not work.
That is such a good question. And who doesn't want cash?
I think that's fantastic.
And it's a really good question in terms of the difference between bribery and reinforcement. And one of the key elements of that, I will say, is setting up contingencies ahead of time in advance of challenging behaviors. And so making sure that you're creating a situation like, if you're going to do these chores, then you will get access to this amount of cash potentially, versus giving an instruction and saying, these are your chores to do, and the child has a real difficult time with that, starts engaging in some inappropriate behaviors, and you say, okay, fine, if you do it, I'll give you some money for it. That would be an example of kind of using bribery versus reinforcement. So it's a matter of just kind of the timing of how you're setting up the situation. So thinking about it in advance. If it's a lot of young teenagers and adolescents, you know, that's a really big reinforcer, is having cash, having access to buying things that they want. So it's really a matter of what you feel comfortable with as a family. If you feel like money as a reward for particular chores is appropriate, you have to think about how much. So it might be 25 cents per chore, with the thought in your head that it doesn't exceed $7 in a week or something like that. Like, you have to have a conversation between your child and husbands and wives and significant others, thinking about what makes sense for your family, what you feel comfortable with, and then also thinking about what the expectations are that'll garner that money. So being really clear about, you know, if you make your bed every morning and you do laundry every afternoon and you empty the dishwasher, and you have all of these things kind of laid out, that each of those things equals up, you know, either a check mark, and if you do all of them, you get a set amount of money, or each one of them is a particular amount of money to yield. You know, each one's 25 cents and the amount of all the chores is $1. It's a matter of thinking about that and setting it up ahead of time, and making sure that the demands aren't, you know, anytime we think about reinforcement, we want to make sure that we're not saying, okay, well, you have to wash the car every day and you're going to get 25 cents. That might not be, that 25 cents might not be reinforcing enough to actually do this very large task. So it's a matter of figuring out how much effort is required in the task that you're asking, and how much reinforcement are you providing.
And I guess as a follow-up to that question, a parent wrote in, how do I get the child to do it for their own goodness sake? And this is something that I often hear when I'm talking about reinforcement systems for children, families wanting the child to be intrinsically motivated.
Mm-hmm. It is. It's a really good question, and something that I think about is, you know, the reason that we do a lot of things, we don't engage in all of the behaviors that we engage in because we like it. I think that we do a lot of things that we love. I 100% love my job and love coming in every day, but I do need to get paid because I do have these other responsibilities. So as much as, you know, if I won the lottery, maybe I could come in every day and not collect a paycheck, but right now that's not something. So I need that additional reinforcement, even though intrinsically I love what I do. And so it's definitely a balancing act. There are some behaviors that we definitely want the natural contingencies to take over, such as going to the bathroom. A lot of times when we start toilet training, we add additional reinforcers to that because a child has to leave a super fun environment and go into a less fun environment, like going to the bathroom. They have to leave what they're doing. They've got to leave their friends and do something that's effortful. So a lot of times we add reinforcement to teach that behavior. And then over time, we thin that reinforcement to the point where the natural contingency of not having to wear a diaper or being wet takes over. And so that's a particular behavior that we hope that the natural consequences maintain the behavior in the future. But not every behavior is like that. So you have to think about what it is what your expectation is. And then when it comes to reinforcement, there are very few times that we don't always think about thinning reinforcement. So sometimes we need reinforcement initially, and more so to just learn how to do something, to learn the value of it. You know, cleaning your room, as a kid, it's something that you really hate to do. Most kids don't like doing it. They don't want to clean their room. But as an adult, you clean your room because you like knowing where things are. You like the look of the environment when it's clean. And so those natural consequences take over. So there's lots of times, I'd say 90% of the time, we have to kind of establish that behavior, and then we think about how to thin reinforcement from it. But again, you know, there's some behaviors where the natural environment is going to completely take over, and then there's some that might require reinforcement forever, such as working, or you know, there are things in our life that we do for reinforcement.
I also think that how we set up the activity and how the child understands that they're engaging in makes a difference. So how purposeful or meaningful it is to that child. It could be that you're teaching a skill in a very isolated type of activity that the child doesn't really understand why they're having to learn, or there's nothing motivating about the activity. And potentially by just making small tweaks or adding some purpose and meaning that attaches to that child's value system or interest, could start to build in that intrinsic motivation for engaging in that. So you make the activity reinforcing in itself or meaningful in itself, versus always trying to add reinforcers outside that are out of context versus embedded into the activity. Christine, just before another question comes through, I wanted to make sure we had a great comment in the chat box about this really nice set of books called ABA Visualized. I know our COO and colleague, Dr. Marlene Sotelo, has utilized these. And this is a really wonderful set of books that goes through talking about all the concepts that you presented today and shows how to add visual supports to be able to teach and to be able to utilize these concepts in a really parent-friendly way, in a really clinician-friendly way, so it translates across the board. So if you haven't seen this series of books, these are really great resources based on the concepts that have been presented today. And I just wanted to make sure it was in the chat box that I showed them, because I happen to have my hands on them right now. So ABA Visualized, and it's by Morgan Van, I think we'll say D-I-E-P-E-N, Diepen, who's a BCBA, and I'm going to mess this name up, but excuse me, Bodwin Van Diepen. So these are a series, there's a workbook and a full manual. So if you have any interest, it'd be a nice way to visualize the ABA and to have the supports already embedded into the strategies we talked about.
You have one question that was in the chat box too that I just want to make sure that I talk to for just briefly about a child with limited leisure and play skills and thinking about how to expand that repertoire. And it's such a good question because we all engage in challenging behaviors when we have nothing to do. And I'm going to destroy this example, but the idle hands, essentially idle hands are not good. So when we don't have productive things to do, we tend to get into things that are less productive. And there are a lot of evidence-based practices that are available to teach play and leisure and additional skills. Some of those are using video modeling. I think that was presented in one of the other Seaver Autism Center presentations. I don't know, Michelle, if there was another one of these presentations that talked a little bit more about increasing leisure and play. I can picture some of the slides.
We did not. We gave some resources to leisure and play activities and the idea of using individuals' restricted interest at this point, just because there has been so much developed virtually to help engage individuals in leisure.
Mm-hmm. Okay, because I think it's a very important topic, and I think such a great question of how to do that effectively. And there are two different the Ocali modules and the Aspire modules, I believe, are two resources that have kind of how-tos of how to implement some evidence-based practices, including like video modeling and social narratives, using a task analysis and visual supports and those types of evidence-based practices, because we have a good toolbox of how to teach some of those skills, but those tools don't work with everybody, so we always have to make sure that we're individualizing our interventions. And I think it's a good question, and definitely something that these resources might be able to guide you into exploring how best to teach some of those particular leisure and play skills.
Absolutely. Michelle, I sent you a private message. There was a message to me about wanting the name of the book and the authors, because I clearly didn't verbalize it with clear English. Apologize. So I did write that into you to be able to share.
Yes, and we're sharing that right now. So I think on that note, it's 1 o'clock, and I know everyone is busy these days. I want to thank you for tuning in today, and thank you so much to Christine and Erin for sharing your expertise. I definitely know I learned a lot today, and hope everybody joining did too. Definitely, if you're not familiar, check out our website, check out the L's website. I posted that in the chat as well. If you have any questions, feel free to email me. The Seaver Center's next webinar will be on Thursday, July 2nd. So in 2 weeks. Again, if you have any topics that you want us to cover, email me or Barry. You would have gotten Barry's email when you signed up for today's webinar. And thank you again. So thank you, Christine and Erin. This was fabulous.
Thank you, Michelle. Thank you, Christine.
Thank you, guys. We're so happy to participate. It was wonderful.
Thank you so much.
Bye, everybody.
Bye.
Bye.